In Chapter 14, we discuss bone, joint, and muscle injuries. Bone injuries usually are associated with some type of a force. It may present in a disfigurement. The real problems are a potential injury to the organs next to the bones that break. So fractures or broken bone mean the same thing. It's a break or crack in the bone. There are two types: closed, where the skin is intact, and open, where the skin has been broken. There are different types of fractures. Green stick is not a complete fracture. It doesn't break all the way through the bone. Traverse, it's cut across the bone at right angles. Oblique, crosses the bone in a slanting direction. Then there's comminuted. Bone is fragmented into more than two pieces. Impacted bone ends are jammed together, and a spiral break results from a twisting injury. When you're looking for a fracture and trying to assess it, remember to use DOTS mnemonic. It means D is for deformity, O for open wounds, T for tenderness, and S for swelling. You want to look for loss of function, whether the patient is guarding the injured area, if there's a history of injury that includes a serious incident. Check for life-threatening conditions first. Remove clothing that's covering the area and look and feel for dots. There's also another mnemonic called CSM that you should be checking. And first you look for the C, or circulation. So you're checking a pulse, and you're doing that in the arm at the radial pulse and in the leg at the posterior tibial pulse. The next is sensation. Lightly touch or squeeze one of the toes or fingers and without the person looking, and then ask which finger or toe they feel. And M is for movement. Have the person wiggle his or her fingers and toes to see if they move. You want to stabilize the body part. And for an open fracture, don't push on the protruding bones. Cover the wound with dressing and seek medical care. Joint injuries occur, and a joint is where two or more bones can come together. Usually what you see is a dislocation, and that occurs when a joint comes apart and stays apart with the bone ends no longer intact. And you can see that sometimes when you just look at an elbow that's been dislocated or a shoulder that's been dislocated, you can see that the joint is not intact. Main sign is deformity. Tenderness, swelling, inability to move it, numbness, or impaired circulation are other signs of a dislocation. If it looks blue or pale, you have to call 911 and check the CSM. If EMS is on the way and they're going to be there quickly, hold the injured part to stabilize until they come. If they're going to be delayed, or if you have to transport the patient, use the rest, ice, compression, and elevation procedure. Do not try to reduce the dislocation. Sprains occur if a joint is twisted or stretched beyond its normal range of motion, and you usually have partly or completely torn ligaments. Similar signs and symptoms to a fracture: severe pain, swelling, and discolored skin around the joint. Use the Rice method or procedure. R for rest. Ice is I, apply for 20 minutes. C is compression, apply to 3 to 4 hours, and repeat the cycle of ice and compression. E stands for elevate, raise the injured part. Muscle injuries pose no real emergency. Usually they occur in the form of strains, and that's when the muscles stretch beyond its normal range of motion. Inflammation begins immediately, but it can take 24 to 72 hours for pain and stiffness to begin. I remember once having a severe injury playing tennis, and I didn't have that pain for a couple of days after the injury occurred. So what you want to look for is, did the person have some type of physical activity that they remember that caused that strain? Is there sharp pain? Is there tenderness? Are you able to use the injured part? And is it stiff and painful when you try to move the muscle? Use the Rice procedure with strains as well. If you have muscle cramps, that occurs when the muscle goes into an uncontrolled spasm or contraction. It can be associated with different diseases such as diabetes and heart disease, and also occurs with physical activity. There are two types: night cramps and heat cramps. Look for sudden severe muscle pain, a muscle often in the calf that feels hard because of a muscle contraction. Residual discomfort may last for a few hours. What you need to do is gently stretch the muscle and relax it. Apply an ice pack. For heat cramps, drink lightly salted cool water or a commercial sports drink such as Gatorade. A muscle contusion is a bruise that results from a blow to the muscle. Usually, the person remembers something hitting that part of the body. Swelling can occur, pain and tenderness, and black and blue marks appear hours later. Use the Rice procedure and seek medical care if any contusion is larger than the person's palm. And that is it on Chapter 14. Again, this is a brief overview, so please refer to your chapter and any other materials in this week's learning module to help you understand more about bone, joint, and muscle injuries.